and welcome back to GP Pod. My name is Dr. Zulkarnain Ahmed. I'm a GP trainer, partner and a coach. And in this video we're going to be discussing about how we can use pattern recognition in the diagnosis of headache as GPs. And in addition to that, if you stick around to the end, I'm going to give you some top tips which I have learned over the years, which have helped me in diagnosis of headache almost on a daily basis, and hopefully they'll be useful for you too. Now, first of all, you might ask, Dr. Ahmed, what's the actual reason for the pattern recognition? As most of you would know, that we only get 10 minutes per consultation, and we see patient after patient after patient, and sometimes that can tire us, and especially when things are not simple and straightforward, that can be difficult and mentally quite exhausting. So if we are able to recognize things by looking at the pattern, then hopefully that's going to help us identify the problem quicker, and the processing time which we use our brain for, that's going to be less, and there's going to be less stress on us, and we're going to be able to make a better decisions. And hopefully that's going to help us in sort of our day-to-day practice, but also is going to help us in our resilience, which is a major issue at the moment in the general practice workforce, particularly GPs. So I think it's really important. So I think the first question which we need to ask with regards to the headache is, what is the actual age of the patient? So is the patient a teenager, for example? Is a patient a middle age, let's say between 30 and 40-year-old? Is the patient over 50? Because the diagnosis is going to depend quite a lot on the age. So for example, generally in young patients there aren't many serious diagnoses, but obviously we're going to keep an open mind, and you can normally start with history of headache, and you can use any acronym, whatever you are used to. Socrates is usually quite a good one, so which is site, onset, character, radiation, and aggravating factors, relieving factors, all of those things. So you can ask the person, where exactly is the headache? How did they all start? How did they all come about? Is there anything which making it better, making it worse? So I'm not going to go into detail of that because you all know that, but I'm just going to focus more on the pattern recognition. So whenever somebody comes to us and we look at our age, we look at our computer and we see, okay, someone who's coming to us, it says on the booking notes that they're coming in with a headache. So we look at the age, let's say they're about 35-year-olds. So what's going through my mind is, what could be the potential diagnosis here? What could be the pattern here? So either in young people who are otherwise fit and well and healthy, not on any particular medication, it's usually either a tension headache, it could be migraine. If they got any constitutional symptoms, so for example fever, temperature, runny nose and things, it could be sinusitis. And of course I'm going to keep my mind open for anything sort of much more unusual than that. I'm going to check for red flags and things like that. So if it's a young person, let's say it's a 16 or a 17-year-old, then I'm going to think about, okay, it's a young person, otherwise fit and well and healthy, then more commonly it's probably a migraine. And if it's not migraine, then obviously I'm going to look for other causes. It could still be very tension related, and there can be other causes, and if they got any sort of viral symptoms and things, it could well be related to that. Obviously in the female, I'm going to check if it's repeatedly happening around the periods, or is there any evidence of anything else. So I'm still going to check for that, but that's what's going through my mind, and that's what's going to sort of help me get through the chase very, very quickly. So if it's somebody who's presenting to us and they're over the age of 50, then I'm going to take that much more seriously, particularly if they're not a migraine sufferer at all. Never ever diagnose a migraine in somebody who's over the age of 50 and never suffered from migraine. It can be much more serious or sinister in people over the age of 50. So I'm going to be thinking about, could it be a joint cell arthritis? It could still be a tension headache. It can be related to high blood pressure, or it could be something more serious or sinister. In that case, I'm going to look for any other sensory or motor symptoms. I'm going to ask the red flags in terms of the headache, whether whether it's waking them up from sleep or whether they're stooping and the headache is getting worse, and if there's any diplopia, double vision, any of those things. So those are the sort of things which I'm going to check, which I'm going to be checking for somebody who's older than 50. So that's how I'm thinking. So just to go on it again quickly. So if it's a younger person, usually migraine are a non-sinister cause. If it's a middle-aged, again, usually sort of migraine or a tension headache or a sinusitis, and not any sort of major cause, provided the fact that they haven't got any other red flags. And then if anybody over the age of 50, I'm going to take it much more seriously. So I'm going to think about joint cell arthritis, I'm going to think about brain tumors, I'm going to think about high blood pressure. So these are some of the common causes. Of course, we're going to look at all the other causes as well. So one of the other ones which we haven't covered so far is a sudden onset headache, which comes very, very quickly. It's like people describe as a blow to the head, or the worst ever headache they ever had, and within minutes it sort of goes to the intensity of 10 out of 10, or some people describe it 12 out of 10. Then I'm going to think about thunderclap headache. If there's somebody describing the headache to one side of the face, around the eye, and it comes and goes, and it's very, very severe when it comes, and it can be few times a day or even hundreds of times a day, and the eye become red and they start getting some water around the eye, then I'm going to think about cluster headache. And obviously if somebody who's quite unwell, they've got really high temperature, they've got neck stiffness or a rash, or even in a younger child, for example, then I'm going to be thinking about meningitis. So those are all the sort of some of the things which I'd be thinking about in a patient of headache. Here are some top tips which are going to be really helpful if you're seeing a patient of headache. Number one, make sure that you ask the patient their ideas, concerns and expectation, which we normally call it ICE. What are they concerned about? What are they worried about? Generally, it's either a brain tumor or something along those lines. And if you haven't addressed those ideas and concerns, then patients are going to go out of the consultation room dissatisfied, and they'll probably be booking another appointment with another GP or a trainee or another clinician. So make sure you address that. Number two, although in most cases in general practice the examination, the neurological examination is normal, but people still expect you to have that done. So make sure you do a neurological examination in a patient who presents with headache. Number three, people also expect you to have the blood pressure checked, especially the middle-aged and older group of people. They would expect you to have the blood pressure checked, so make sure you check the blood pressure as part of your examination. And the most important thing out of all of those things is reassurance. People are generally very worried about headache, and they're worried about could it be something serious or more sinister. Some people may want a referral for further imaging and things, but reassurance is the key here. And generally, like we said, most of the causes of headache are benign, and they can be sort of treated without any sort of major investigations, and sometimes if we do send people for investigation, we may find things which are there like an incidental finding, and then people start worrying about that, and that can cause all sorts of problems and issues. So be mindful of that. Again, another one which we haven't particularly talked about previously, but again can be a common cause, is stress and anxiety and tension headache, which can feel like a band around the head as well. So bear that in mind. So those are some of the ideas about seeing a patient and recognizing the type of headache and acting accordingly. So for example, now how would you investigate it? That depends on the cause, but generally if you're thinking about investigation, you may want to do some full blood count, urine electrolytes, and ESR or CRP if you're thinking about if they've got constitutional symptoms, or if you're thinking joint cell arthritis, and you may want to consider the treatment as well with steroids, but and then refer the patient accordingly according to the local pathway. So thank you very much for watching. Like this video, please subscribe to the channel, and I'll see you in the next episode. Up until then, bye bye.